and welcome to TTV and our brand new show where we'll be discussing all the latest updates, news, what's buzzing on the social media, and all that you need to know to have that ease of living in this beautiful country. And lately, what really has been buzzing and has been the talk of the town are the surging numbers of coronavirus, not just in the Sultanate, but across the globe. And for that matter, we have none other than the expert himself. So let's welcome His Excellency, Dr. John Jabbour, who's the representative of the World Health Organization here in the Sultanate of Oman. Thank you so much, Your Excellency, for joining us. What a pleasure to have you here today.
Thank you. Good morning, and good morning to all. This is a very good introduction, by the way, and especially about the surge in number of cases and why people they have to take a lot of care, because COVID-19 did not end yet.
Okay, Your Excellency, you're starting on a very scary note. And before we get into detail, Your Excellency, would you elaborate on the current situation of the COVID?
Let me start first by saying that WHO, the World Health Organization, signaled year 2022 to be the year of solidarity. We have all of us to join efforts together to combat this pandemic. And this is not an easy task for the governments, for the community, and for the individuals also. For the situation as the situation all over the world, we see now with the flu season that the cases are increasing everywhere in the world, and we have a surge in number of cases here in Oman. When we have such an increase, the good thing that the government is on top of this, and they do situation analysis on weekly basis, even less if the situation demands. So this is an important step. That's why they always release information for the public and timely information. And this is a very strong point for the surveillance system of Oman, especially our colleagues at the Ministry of Health. So this situation now, as we said, there is an increase in number. But for numbers, the most important, how much we are going into severity of the disease, how much we have moderate to severe to critical cases, how much we have admissions to hospitals, how much we have admissions to intensive care units, because this is what makes the health systems overloaded and at the same time will deprive all the resources of the government. So what we should do, we as government, we as community, it's a joint responsibility. We should put hands together, we should apply the simple public health measures, and then of course increase the vaccination coverage. For the situation, yes, the numbers are increasing, and I want to say here, please, it's the responsibility of every individual to make this trend decreasing instead of increasing.
Right. Your Excellency, you mentioned about the analysis, which the government releases every now and then. And recently, the Ministry of Health released the analysis indicating that every 6 days, the numbers are doubling in the Sultanate. Is this something that we should be worried about?
Look, for the science of viruses, this is important to know, and every individual to know that we will be having a lot of mutations, we will be having a lot of variants, and the characteristics and the spread and the infectivity and the severity of the virus differ from one variant to another. With Omicron, like the start of Delta variant, it's a variant of concern for WHO classified, and also Omicron, because it spreads very quickly, and even the infectivity is so quick in few seconds. If we are in a distance of verbal conversation, this might transmit the virus in 15 seconds to a healthy person. So that's why we insist on applying the public health measures and how to live with this virus and how to live with the mutating variants, because this is important. We are hearing every day variants, mutations, variants. This is normal for the science of viruses, under virology, because viruses like the flu virus, for example, they mutate millions of times per day. And that's why if you see the vaccine, how it is composed at the end of every year, by a global network of surveillance, they see the strains circulating all over the world, and then they combine the most common three. This is the vaccine of the flu. Now studies in parallel with what is going on during this pandemic, the studies are ongoing to see what are the most effective measures to stop the pandemic, because we are in a pandemic stage, in an epidemic stage. We didn't yet reach the endemic. The endemic, this means the virus is living with us, and we have to live with it. Now we're not at this stage. That's why we have the booster dose 3 to 6 months according to the policy of the government, and this is recommended by the Global Advisory Group for Vaccination. So if we see this trend, I can say here, and this is an important message, please, when there is a variant and there is a quick spread, this doesn't mean we are reaching the end of the pandemic. With viruses, this might happen, but it is very premature to say that Omicron is the end of the COVID-19 pandemic. This is not right, and this is a wrong perspective, and this is what makes the community will release the measures, not applying the simple public health measures, and then numbers will increase again, more admissions to hospitals, more admission to intensive care units, more death. And this is what we don't want. And I want here to really acknowledge the transparency of the Supreme Committee here in Oman. They are doing fantastic job, and they are very transparent with the public. So please, for the public, take the measures seriously, apply it even within the family gatherings, not only in commercial places or outside in public places. No, in simple family gatherings, you should apply the measures, because I am out, every family member is out, so we don't know the exposure of every member of this family. Applying the simple public health, wearing a mask, cleaning your hand, keeping physical distancing at home will also protect other family members from getting the infection or being infected, and will help in decreasing the numbers and therefore going back to a decreasing trend. Because if we continue increasing, the government will be obliged to apply more and more strict measures, and we might go to measures of the previous cycles. And we don't want to reach this, but it is in the hand of every individual in this community.
Right, Your Excellency. You rightly pointed out that the change comes within. If you do not take the responsibility of the change, and the government is doing an incredible job, like you said, then that wouldn't be implemented, for the masses here. And talking on those lines, Your Excellency, about vaccination, it has been indicated that a lot of fatalities were the cause of people not getting vaccinated. How important is to get vaccinated?
Look, in the science of infections and in infectious diseases, it is one of the major, most important medical intervention, because I want to speak about two types of interventions here. We have the non-pharmaceutical or non-medical, where wearing a mask, keeping physical distance, washing your hand, not be present in crowded places, good ventilation system within the closed settings. This is we call it non-pharmaceutical. For the pharmaceutical or medical intervention, this is one of the intervention that is very important in many infectious diseases that result resulted either in elimination or eradication of a virus, of a bacteria, of another microbe that might cause an infection. So vaccination is an important measure, a public health measure that is important to cut the transmission of the coronavirus. And with the public health or the non-pharmaceutical measures, the package, this will help in cutting and making transmission difficult. Because when we have a pandemic, this means the transmission from one person to another is very easy. So how to make this more difficult for the virus to be transmitted from one? Through vaccination and through applying the public health measure. So vaccination is very important, and it is good because there is some misconception among the people that because it was very quickly produce the vaccine, this means it is not safe, it is not effective.
Yes.
This is completely wrong information, and I want to stress on this. Please take the correct information from the right sources, from the experts, not from any type of communication that is giving wrong information. And here I want to stress on the social media. Social media, you might have lot of information, right, but not all these information are correct or based on a scientific evidence. This is important. So vaccines are safe, effective, are the most important measures to stop this pandemic. The more coverage we have, the more we are hoping, and it's all coverage for all, not for one country and for 10 countries. No. All countries should have high coverage rates of vaccination in order to stop the transmission or this pandemic.
Right.
This is unfortunately is not happening all over the world because inequity in vaccine distribution is making the difference.
Right.
And that's why WHO, World Health Organization, is always raising the voice that we should have equity in distribution. All people in the world, we have to reach, for example, 40% of vaccination all over the world by December. We didn't reach this target. Now we are aiming at 70% in June 2022. So a lot of effort should be done to get this rate of vaccination. When we reach this rate of vaccination with the public health measures, I will tell you this will become the beginning of the end of the pandemic.
Right. And without it, we're still going through
we
the
cannot
pandemic.
reach the end of the pandemic.
Yeah, right. Like you said, Your Excellency, if one country is, all secure and the other countries are not safe, the traveling would be, restrictions would be there. People wouldn't be able to go home.
Right,
And if they
right.
do, they'll be bringing the virus again. So the whole cycle keeps revolving until
Always.
the equity.
And easy.
Yes.
Easy transmission throughout the whole cycle.
Yes, absolutely.
Yeah.
So, Your Excellency, while we're talking about vaccination, and you said that people are, having this myth or this misconception that the vaccinations are not safe because it produced so quick. Now, while the vaccination is another problem, and now people are skeptical about getting a booster shot. So what would you like to tell them, or what advice do you have for those people?
This is another important stage in the fight against this pandemic. And when WHO, the World Health Organization, gives or makes a recommendation, it is not made haphazardly. It is not made without science. It is not made without studies, without investigation. And this is the global advisory group that gives such recommendation. So it's based on studies, on information from countries like Oman. Oman, they do a lot of studies and they share this information with WHO. Then we do meta-analysis at the level of the globe, at the global level. And according to this, we give recommendations about vaccinations and why a third booster is important or a third dose important, because when studies prove that immunity is decreasing with time and with variants decreasing quickly, then a booster is needed in order to again boost the level of immunity within individuals. When I have this level, high level of immunity, this means I am not allowing the virus. I will be reinfected. Vaccine doesn't prohibit reinfection. This is for all to know, but cannot reproduce to a viral load easily that produces a severe disease or a viral load that can be easily transmitted from one person to another, and we will be having more than a cycle with another cycle with another cycle. This is the important issue. That's why it was recommended the third boost. Hala, when are we going to stabilize this and to see that we are going into an annual boost or more than annual? This all depend on studies that is ongoing with the current situation. Progress in the pandemic and the efficacy and the impact of the vaccines on the transmission of the virus. This is something that is important. Every individual should take the boost dose, the third dose. And this is a very strong message I want to give through you here, because don't only say that I have the 2 doses, I am fully vaccinated, I am fully protected. This is also an incorrect information you are receiving. Immunity decreases with time after the infection, whether by vaccine or natural. So we need to take the vaccine, we need to complete the primary doses, and then we have to take the boost in order to again increase the effectiveness of the vaccine. This is very important. Every individual, again I say it, is responsible with the government, to end this pandemic. If we don't apply these measures, we're not going to end. Oman is doing very well in the way applying the measures, having good and strong recommendation through the Supreme Committee. This is very important, and this is all based on a global advisory group and WHO recommendations and other also international bodies. So it is based on science. So please take these recommendations. Always take information from the reliable source, not from any source that we don't know the base of such information, and apply it. And if, and I am sure, and this is said by His Excellency the Minister of Health, Dr. Ahmed Al Saidi, they don't apply any recommendation if this recommendation is not for the benefit of the Omani community. When I say Omani community, residents and non-residents all together. And thanks for the governments that is taking care of all people, Omani and non-Omanis residing in Oman.
Absolutely, Your Excellency. That's one thing that we all agree upon, that here the health measures and the implementation, and especially the vaccination drive that started for the people of this country, was something that we should applaud, because when the different countries were, struggling to get vaccination, Oman, got the vaccination just in time for the country to be vaccinated. Now, talking about the role of the country, Your Excellency, how do you see the role of the government, in procuring vaccination just in time for the people?
Look, there was also at the beginning where some of the people, they were saying in social media everywhere that Oman is delayed in procuring the vaccine for its population, and it's not a matter of if we procure now or tomorrow or after tomorrow. It's the matter how safe is the vaccine, how effective is the vaccine, and this is all based on science, on studies. And Oman, they don't take any step forward unless it is strongly scientific and evidence-based. Okay, that's why when I hear such speeches among the population, sometimes I go into discussions and I say, no, it's better to have anything planned, scientific, and to know what is the impact across the community. If I don't know the impact very well, so I don't bring anything that If not, instead of protecting, it might harm. That's why the role of the government in procurement, in the immunization plan, if you see the vaccination last year, it was started beginning of July, yes?
Right.
In how many days Oman has exceeded 40%, in like 60 to 70 days, has exceeded 40% fully immunized with the 2 doses for the population, Omani and non-Omani. This is how, if you have a good immunization, national immunization program, Oman, since in 2016, classified the first country in managing the national immunization program all over the world. It was number 1. So they have a very strong national vaccination program. And through the strengthening the primary healthcare system in Oman, they are reaching most of their population, and the catchment areas are increasing. That's why from the beginning I have no worry that Oman will start the vaccination and will boost up very quickly, and this is what happened.
Yes.
Now, according to the Omani model, 18 plus, they are already reached 94%, at least 1 dose, with 87% fully vaccinated. This is if we take the denominator 18 plus, according to the Oman. According globally, because globally the denominator is the total population. So Oman now is 61%, at least 57% fully vaccinated. By this, exceeding the global target, which is 40% in December. And they are continuing. They are continuing in the 3rd dose, which is increasing now, protecting, availing the vaccine, timely procurement. You know, in each pandemic or a newly emerging infection, there will be a challenge in production of a certain intervention, including vaccine, and the government's agreement with such productive sites. And this is what happened at the beginning. But to rest assured for all the Omani community, Omani and non-community, Oman government doesn't take any step if this is not giving 100% benefit to the population.
Right, Your Excellency. Because like you said, that people say that it came late to the country, but it's because Oman, the government wanted to be sure that the vaccine that they're bringing in, people do not require additional doses, because that's what happened when people were rushing into getting vaccines in different countries. They got the vaccine initially, but after 6 or 8 months or after a year, they had to do it all from the scratch.
Yes.
But thank God here in Oman.
You know, that's why we are asking people to go by the government policy and listen from them and see what recommendations. And they are very transparent, by the way, releasing all information to the public, the needed information to the public. This is what we want. So why to go and listen from other sources? Why to go and compare to others, which according to their policy might be right, but because every country has its own specific context. So that's why we have to go more into the government policy, and thanks God this is moving on the right track and progressing very well.
Absolutely. Now we are seeing on the Ministry of Health there every now and then they're announcing about the availability of 3rd booster in various health centers, so it's not restricted to just one place. Talking about, last question, Your Excellency, about Omicron.
Yes.
We all know that Omicron has gripped the world. The cases are surging everywhere in 3- and 4-folds. People are a bit more worried in Oman because, you know, from coming to just a few numbers of COVID cases in the last few months to now in thousands. How do you think we as people of Oman can help the government to bring down these numbers?
First, let's take it in 2 directions. The first direction, if we see the global trend, we're not different from the global trend. This is very important. If we see it from the local perspective, yes, it is from few cases with zero death for several days to thousands of cases. But at the same time, see it from the impact on the health system. The previous cycle, what was happening to the health system in terms of facilities, in terms of care, in terms of ICU, and what is happening now. So if I have thousands of cases, this means that people are not applying measures properly. And they should help the government in applying the measures. If I protect myself, I am protecting you, I am protecting my surroundings, I am protecting my community. I am helping the government also in reducing the cost of this pandemic and supporting other important medical public health programs that should not stop. And this is, if you see the picture from a broader image, not from the angle of Omicron or COVID-19, you can see why the government is always pushing, please help us, please apply the measure. It's very easy to wear a mask wherever you go. It's very easy to keep a physical distance. It's very easy also to clean our hands when we touch things, and it's everywhere. It's everywhere, in malls, in shopping areas, in the street, everywhere, in restaurants, or it's everywhere. It's very easy to think properly about the safety and efficacy of the vaccine. We know that there are some anti-vaccine groups that increasing the hesitancy of taking the vaccine. But when these people are infected with coronavirus, they, after infection or being infected, they see the importance of the vaccine. So please, please, these measures, applying the measures, getting vaccinated, and get rid of the wrong information, of the misconceptions, of everything. Get rid of it. Vaccine everywhere for our children, proven to get rid of so many diseases. Of our children now are very healthy all over the world because of the vaccinations.
Yes.
So why, because we are in a pandemic and we want to cut this pandemic, we are always suspecting the vaccine? And it's not in one concept saying that this was very quickly produced. No, we have vaccines done even in a shorter time than corona vaccine, COVID-19 vaccine. So we should not listen to these people who are not in favor of the health of you and your community. And if these people, they want, always when I have certain discussions with these people, please show me your scientific evidence. When I talk to you about the efficacy, about the safety, I have a lot of papers to show you. What are you showing me? You are only saying theories which are very far from medicine, very far from science, very far from also protecting the health of your community. So I advise every single individual to help your government. Please apply the measures. Don't hesitate. Don't say that we are at the end of the pandemic. No need to apply the public health measures. No need to get vaccinated. This is very wrong, and you should be an integral part. You should be an essential, a core part of ending this pandemic with your government.
Right, Your Excellency. Thank you so much
you.
for having such a constructive discussion with us and informing the public about the misconception and the myths and the delusion that everybody is living in. That was a much needed conversation with you, Your Excellency, because, you know, coming from the right source, like you said, is better than reading on social media and then hearing from your friends and colleagues or family members. So once again, thank you so much, Your Excellency, for taking out time and answering to these queries that we usually have.
This is our role, and thank you for hosting me. And I think hopefully then we will be having more messages to the public through you, because this is very important stage, and very important also to be moving according to the recommendations of the government and to help in ending this pandemic very soon, inshallah.
Absolutely, inshallah. Thank you so much once again.
Thank you.
For more interesting videos, stay tuned and keep watching TTV.